Hey guys, this is Brock from Command, and today we're going to be talking about obstructive sleep apnea. Now, sleep apnea, it's estimated that about 86 to 94% of people that have obstructive sleep apnea are not diagnosed with it, and therefore most likely not treated for obstructive sleep apnea. And the tough thing about that is that sleep apnea, if not treated, is a significant risk factor for stroke and heart attack, and also tends to really punish one's ability to get restful sleep. And it can lead to a number of things. It's kind of linked to diabetes and obesity, heart arrhythmias, high blood pressure, a bunch of different things. Now, what is obstructive sleep apnea? Obstructive sleep apnea is basically when your breathing pauses multiple times throughout the night because the base of the tongue area relaxes back on the back of the throat, and basically you stop breathing anywhere from just a few seconds at a time, sometimes more than a minute at a time. And depending on how many episodes you have and how low your oxygen levels get and how long you pause your breathing will determine whether you have sleep apnea, and if so, how severe is it. As far as common symptoms of sleep apnea, sometimes we see significant morning headaches that are fairly frequent. We also see sleep apnea tend to cause significant daytime sleepiness, and we like to use a screening assessment called the Weisfogel Sleep Disorder Assessment. And what this does is it approximates how much daytime sleepiness you have, which is one factor, as well as a number of other risk factors: high blood pressure, heart arrhythmia, needing to take pain medication chronically, the size of your neck for women, if your neck is larger than 15 inches, or men larger than 16.5 inches. These are all risk factors for potentially having obstructive sleep apnea. If there's any question in your mind whether you might benefit from getting screened for sleep apnea, make sure to touch base with your Command provider to see if you might need to be tested for obstructive sleep apnea. Also, the Weisfogel Sleep Disorder Assessment can easily be found online. Just make sure that you're always talking to your provider about your personal risk for obstructive sleep apnea. Now, as far as what actually causes sleep apnea, we know that obstructive sleep apnea tends to be more common in people that are significantly overweight or obese, because that tends to increase kind of the size and congestion of the internal anatomy in the back of the throat. But we also see it in individuals who have maybe a receded mandible or receded jaw. And some people who are, let's say, not overweight at all may still have sleep apnea because their jaw is receded, or because genetically they were born with a kind of congested anatomy, small anatomy in the back of the throat. So it's just good to know that you don't have to be overweight to have sleep apnea, and just because you're overweight doesn't mean that you necessarily have obstructive sleep apnea. So how is sleep apnea treated? Well, obstructive sleep apnea is treated either through an MAD, which stands for mandibular advancement device, or a CPAP or BiPAP. Now, just think of it this way: an MAD, or mandibular advancement device, is kind of like a retainer that you wear in your mouth that brings your jaw forward by around 1 to maybe up to 3 or 4 millimeters. And sometimes that protrusion, that pulling forward of your jaw, is enough to fix the congestion in the back of the throat, the collapsing of the base of the tongue on the back of the throat, to relieve sleep apnea. But it's worth noting that if you do use an MAD, you generally need to be retested while using the MAD to see if that MAD is truly fixing the sleep apnea. Now, a CPAP provides continuous pressure down the airway to help keep the airway open while you sleep, and this is generally used for, well, most levels of obstructive sleep apnea. But sometimes people need a BiPAP, where the pressure is not only pushing to keep the airway open, but also pulling to help the air escape while you're breathing at night. And we see this especially with severe enough sleep apnea diagnoses. For more information on sleep apnea, make sure to reach out to your Command provider to see if you might benefit from getting tested, if there's any potential there. Now, our featured service this month is going to be two things. The first is that we can get these sleep studies performed through Common Sleep, which is just 2 doors down from Command Springfield location. And this is an in-home sleep study for currently the price is $199, which is nice that you can get tested for sleep apnea in the comfort of your own home for a couple $100. Those results are sent to your provider, and then your provider will reach out to you with those results and discuss them. Secondly, we are helping kind of roll out a new kind of medical expense coverage called HAC or HAP. HAC stands for Health Access Cooperative. This is a monthly payment that you make to this company not to Command, but to a different company that will help cover those emergency related medical expenses as kind of an alternative to traditional insurance. And the HAP stands for Health Access Preventive, and this helps cover things like primary care visits, as well as up to $3,000 a year coverage for counseling, up to $500 working with a nutritionist per year, up to $250 for dental, $250 for vision, even money towards gym membership, all kinds of kind of preventive coverage. And so this is a great alternative to insurance. And if you want any further information, reach out to info@command.md and we'll make sure to send some information your way. Thanks guys. This concludes October's video newsletter for Command, and we'll see you in the next one.